I grew up in a horse family first, and so I started with 5-6 years already in riding and handling with horses, and later on a breeding farm. And I was very active as a jumping rider. And then I studied veterinary medicine at the university in Hanover and became graduated in 1979, long time ago. And after that, first I worked 1 year in normal practice with each discipline and animals to get a little experience in all. And then I went back to the university in Hanover, specialization for equine. There is a horse clinic which is doing everything on the horse. So in the other universities, they have just a clinic for surgery, and they do on all animals in the surgery. And here in Hanover was a big advantage that we had one clinic for horses, and we did everything. So you get a lot of experience with the horse. And then after that I started my own career with breeding and orthopedics already. I went to the Oldenburg Breeding Association area, which is very, very strong in breeding and riding. And so I was involved generally in everything, on warm-blooded horses, even on trotters, with so-called Mr. Alvin Schockemöhle, the gold medal winner in Montreal a long time ago. But he moved on from the jumpers to the trotters and had Diamond Way, so a very famous winner of the Prix d'Amérique in French. And so I was involved nearly in lameness and pre-purchase examination and cryopreservation of stallions, a lot of lameness, pre-purchase, I think. Like a generalist. And and I started my own clinic. We built a new one 1990, and then for 5 years ago I retired as a partner, and now I'm a freelancer in my own clinic, or in my old clinic, and just do what I like to do. I worked with BEMER, I think, around about 5 years. And we started first in the beginning and see how the horses react with the blanket, so the outcome. And we have many magnetic field therapy companies on the market. Every one is a little bit working different. And so we saw that the horses relaxed, especially in the training and young horses. And then I was a little curious about it, and we did a little bit more on it, and then we made the user observations in horses for surgery, and so also there's a reaction, and started then the larger study at Dr. Körner and Stefan Leser, and also we did then the observations in the stallions, and also there was a very good observation that you see that the stallions became different or influenced in the behavior. So the normal horse then probably doesn't make a difference if you put a blanket on or not. But the tricky horses, therefore it's good to have it. Yes, I can recommend BEMER. We don't see any problems, and you cannot disturb anything. And it helps if you can influence the behavior to the positive side, then it's welfare for the horse, it's more safety for a human.